Please join your hands together in welcoming our esteemed next keynote speaker, Dr. Syed Raza, the consultant cardiologist at Awali Hospital, Bahrain. He is dedicated to advancing cardiovascular care through clinical excellence, innovative treatment approaches, and steadfast commitment to improving patient outcomes. Put your hands together to welcome him.
Thank you very much, Samira, for the kind introduction. Guest of honors, colleagues and friends, a very good evening. At the very outset, I would like to take this opportunity to thank the organizers of Healthcare Innovators and Excellence Awards 2026. I'm greatly honored to be here in Dubai. This is not the first time I'm visiting, but certainly Dubai is a place I love to come again and again. So when I was given this opportunity, I thought as to what exactly I should be speaking about. Certainly this is not a medical conference or a scientific meeting, which I can talk about my subject in depth and will be more complex for the audience who are attending today. So I thought of choosing a subject where I can talk about and more importantly, provide that message that goes out to the audience that heart, as I said earlier, is an important organ of our body. It is a sensitive organ, but the main engine that drives our body. So if the heart fails, so everything fails. So first and foremost, I would like to ask a question, and two questions actually, as to what this picture shows. And it's not a brainer, and I'm sure everybody will guess what exactly it is. And you will all recognize that these are well-known celebrities. Some are athletes, they are actors in Bollywood, singer, and also some famous politicians. But the second question is more important as to why or what is the common connection between these individuals. Anybody? Sorry? Correct. So they had sudden heart attack or sudden cardiac arrest, well guessed. And not only that, they actually died prematurely. So some of them relatively prematurely they died. So sudden heart attack at a young age is indeed a problem, and we know that. But despite that, we are doing very little to prevent heart attacks and early deaths in those individuals who die suddenly in their prime health when they are still, the age is very tender. So in the next 15 minutes or so, I'm going to take this opportunity to answer the three hows: how big this problem is, how to identify the problem, and how we can prevent. I think that's the most important part, as how we can prevent and deal with the problem. So cardiovascular disease, in a very simple terms, it mainly is to do with the heart, which we call coronary artery disease of the arteries in the heart. Then the cerebrovascular disease, where there is disease in the arteries that goes to the brain. This is cerebrovascular disease. And then peripheral vascular disease, the arteries that carries blood to your limbs, legs mainly, or the arms. Now, this is not something new. Everybody knows that cardiovascular disease is highly prevalent. There are 626 million people who are living or suffering from cardiovascular disease. But the other fact is that out of these individuals, 20 million people, more than 20 million people will die with cardiovascular disease every year. And that accounts for at least 33%, one-third of the deaths all across the globe is because of the cardiovascular disease. And if you compare, because we all fear and talk about cancer, but if you see on the slide, it is the cardiovascular disease that kills more people, double the number that the people are killed with cancer. So certainly it is something to take a note that cardiovascular disease is important, and there must be ways that we should prevent. But more important than that is sudden cardiac death. Now, when I say sudden cardiac death, is a death that occurs without prior symptoms, without prior warning. And out of those individuals I mentioned, 20 million people who are dying every year because of cardiovascular disease, 25% of them, they die suddenly. And unfortunately, I do not have any figures from this part of the world, but in the United States, per day, more than 1,000 individuals, they drop dead without any prior symptoms, without any warning. So they die suddenly. Sudden cardiac death can happen in the hospital. It can happen in your home. It is happening in the offices. It's happening on the football pitch. It can happen on the train, at the airport. So sudden cardiac death, when it happens, it does not knock on your door. It just comes suddenly. If somebody has a sudden cardiac arrest in the hospital, then he or she may be lucky because there are resources, people are around there, and they can get the medical attention on time. But despite that, the survival from sudden cardiac arrest in the hospital itself is very little. About 1/3 of them, they survive. But how about if the sudden cardiac arrest happens outside the hospital? Here, the survival is much less. Only 10% will survive, unfortunately. Now, I'm not going to go into a lot of medical details because I know there are some people who are non-medical. So just to put into perspective as to what are the causes of sudden cardiac arrest. Now, if I divide the individuals into two groups, it's not more than 35. I apologize for that. It's less than 35. So younger individuals who are less than 35 years of age, the problem is not heart attack. You will probably read in the newspaper or will see on the television that such and such young player died suddenly due to heart attack. No, that's wrong. So media people, everybody is labeled as heart attack. So what happens here, it is cardiac arrest, and that this is not due to heart attack. There's no problem in the heart artery, but the problem is in the structure of the heart, probably a muscle problem in the heart, or there's problem in the electricity, how the electricity is generated and how it transmits across the heart. So younger patients, they suffer cardiac arrest and sudden cardiac death because of heart muscle problem or electricity problem. On the other hand, when the individuals are more than 35 years old, if they're older, then the problem is in the heart arteries, which we call coronary arteries. So that is heart attack. And this is probably the most important cause for sudden cardiac arrest and sudden cardiac death. Now, good news is that 80% of the heart attacks and strokes and indirectly sudden cardiac death are preventable. But the fact of the matter is that sometimes it is too late to prevent a heart attack and stroke. Now, obviously, the question as I posed that it is preventable, but we are not doing enough to prevent. It comes from that people do not sometimes recognize their symptoms. And if they do not recognize the symptom, they do not acknowledge it and do not meet the right person or the physician or the cardiologist to seek help. So sudden cardiac death, we say it is sudden, but the question again is it really sudden? And there are some studies which have been done, and one of them I've just quoted is done by some German researchers, and they have found that no, there are some preceding symptoms, there are some signs, the warning signs the patient actually or the person actually gets. But unfortunately, that person ignores those symptoms. It may be in the form of some chest pain, dizziness, some shortness of breath, palpitation, even fainting. So these are some of the signs or symptoms, but the person may actually ignore and never seeks any medical attention. Furthermore, there was another study. It's a relatively small study, I would say, but 16 hospitals in Oregon in the US, more than 1,000 patients were studied, and they also showed that at least 75% of those individuals who survived had some kind of symptoms, either 24 hours prior or even weeks before. But unfortunately, they did not seek medical attention, and therefore they suffered a cardiac arrest or a sudden cardiac death. So what is the solution? So the way forward is obviously you've got to recognize your symptoms if you have any. If you do not have any symptoms, then at least know the condition of your heart, because unless you do not check, you will not know. No matter how fit or well you look from outside, this does not tell you the inside story. The inside story may be very different. So certainly this is a message I want to give to all of you, that please get your heart checked. And this comes to what we call a cardiac screening. So we may have just the tip of the iceberg, which you will know about yourself, your condition, your body, but majority is still hidden. So that is something has to be consulted with your doctor, with your cardiologist, to investigate you in detail and find out what the underlying problem is. So cardiac screening, again, just the last part of my talk, which is very important to understand. It's a very simple thing, that all you need is to see your doctor and discuss with him or her if you have any symptoms. If you don't, then again, if you want to get your heart checked, then again, it's very simple. First of all, it will start with a risk calculator. There are few risk calculators that helps us to predict as to what is the risk of future heart attack and stroke in any individual. And few of them are shown here. I'm not going to go into the detail because there are some non-medical people. I don't want to confuse them. But there are calculators that helps exactly to predict as to what is your risk, future risk of having a heart attack or stroke in the next 10 years, next 15 years. Simple tests are available. ECG, all of you are familiar with, is a 12-lead ECG, is electrical tracing of your heart. And it gives you a lot of information, not only about if you have had a heart attack or you are at risk of heart attack, but also it tells us a lot about your electricity problem that can lead to cardiac arrest in young people. It tells a lot of problem if there is any problem in the heart muscle. And then is echocardiogram, which is ultrasound of the heart, that gives us a beautiful structure of the heart, helps us to recognize if there's any problem in the heart muscle pump or any other problem. Stress ECG, as you see, is a treadmill test where we make the patient or the person walk on the treadmill and then take continuous ECG. And there's also use of ultrasound for looking at the neck arteries, which we call carotid Doppler ultrasound, and then a CT scan. So carotid ultrasound is very important. It is actually a very good way of looking at is to what is going on inside your heart arteries. So carotid ultrasound is looking at the ultrasound in the neck. If there's any plaque building, any narrowing in your neck arteries, that can lead to stroke. But it is a surrogate and gives you a lot of information as to what might be going on in your heart arteries as well. So these are some of the pictures that looks at the plaques that develop in the inner lining of these carotid arteries, and also tells us with the flow of the blood as to what is the degree of obstruction in these arteries. CT scan, again, this is not very new, but relatively new way of looking at the risk of future heart attack and stroke. It first of all picks up any calcium deposit in your heart arteries. More the calcium obviously means more the risk of future heart attack and stroke. So this is the way we calculate. We take the total number of calcium deposits, and greater the calcium, it is supposedly a risk marker and helps us to predict as to what the risk of future heart attack and stroke is. So what does the zero calcium mean? Does it mean no disease? So a lot of studies have been done, and they say if you have zero calcium, then yes, your risk of future heart attack and stroke is zero. But I would say if it is younger patient, and if the person has symptoms, then the calcium zero does not mean anything. So why? Because the calcium takes time to deposit and show on the CT scan. And sometimes what we see is a soft plaque. Soft plaque will not have any calcium deposit. So for younger patients, this is not enough. If we suspect that there might be underlying coronary artery disease, then we inject the dye, which is called CT coronary angiogram, and then look at this plaque in more detail. So as I said, these are the patients or the person who should have a CT scan. But again, for screening purpose, even asymptomatic patient, you have no symptoms at all. You may have some risk factors, then still you can have the CT scan to look at the calcium deposits on your heart arteries. So obviously, there is a goal. We have a goal to succeed in life, to make money, to do well in our career, but also should not forget that we should have some healthy goals, and healthy goals to have a healthy life and also have a healthy heart. So having a well-balanced diet, regular physical exercises, no smoking. If somebody drinks alcohol, then obviously to stop drinking alcohol. If you have risk factors like diabetes, high blood pressure, high cholesterol, so they must be controlled as well. And certainly do not take much of stress and sleep better. So two important risk factors, the most important risk factors for future heart attack and stroke. One is smoking, and number two is diabetes. So these are the two important ones, diabetes and smoking. These are the two important risk factors for future heart attack and stroke. But more important than that is ignorance. So I consider this is the most or the biggest risk factor for future heart attack and stroke is the ignorance. So there are people who would get the information from the wrong sources. They may be misleading and they misguide us. So have the information from the right sources. Do meet the real doctor before you meet Dr. Google. So that's probably is an important message again, because as you know, in social media, there are lots of information, and these are actually, unfortunately, misinformation. They are going to misguide you. And finally, as I mentioned about the cardiac arrest, so definitely this has to be prevented. A sudden cardiac death has to be prevented. And for that, first of all, you have got to know how to recognize that cardiac arrest has happened. So this can happen anywhere. Even in this hall, God forbid, somebody may actually collapse, have a cardiac arrest. So you must know how to recognize, first of all, that a cardiac arrest has taken place. Then next, you have got to respond, ask for help as soon as possible. You must have some kind of idea as to how the resuscitation is done. This is called cardiopulmonary resuscitation. And that red box, what you see, some of you will recognize, this is called automated external defibrillator. So this is utilized if person has got abnormal heart rhythm that you can put on the chest and give a shock. This is automated external defibrillator that sets the abnormal heart rhythm back to normal beating rhythm. But more importantly, we have got to educate people. We have got to make people aware. So these are the pictures taken during the COVID period where we ran some educational campaigns in my company and hospital, and we were doing that online. So we did not do physically, but we did that online. But I do run a lot of activities educating not only the doctors and the nurses in the hospital, but outside in the community, the members of the general public, to know as to how to recognize these cardiac arrests when they happen, and what are the steps you would take, how we'll respond. And just to give you some figures, if the help is not, if you do not seek help on time, then the chances of survival of a person decreases by 10% per minute, 10% per minute, and no help is given for 10 minutes, then you can imagine that the chance of survival for that person is 0. Yeah, so this is important to remember, 10%, the chance of survival decreases per minute if you do not seek attention. And if you do not seek any medical attention for 10 minutes, then the chances of survival is actually 0. So I would, with that last slide, I would wish that it is an important message I have been able to deliver to you all, that look after your heart, get your heart screened, and certainly do know how to recognize cardiac arrest so that you can prevent some precious life. Thank you so much.